Good morning. Good morning. Good morning. On behalf of the Gamma Pi chapter of Omega Psi Phi Fraternity Incorporated, I would like to thank everyone for tuning in this morning for another Health Initiatives webinar series. I am your host, Brother Arden Garnett, and today's topic, we got a good one, will be STD STI Awareness. STD stands for Sexually Transmitted Diseases. STI stands for Sexually Transmitted Infections. Our presenter this morning is a dear friend of mine, Miss Ann Wiseman. And before we bring up Ann, just want to give her proper introduction. Ann Wiseman is the Deputy Director at Heart to Hand Incorporated, a nonprofit community-based organization in Prince George's County, Maryland, which focuses on sexual health and wellness, including HIV, STI treatment, prevention, and care. Prior to joining Heart to Hand, she was the principal of Ann Wiseman LCPC, where she provided mental health counseling, counseling supervision, and nonprofit program consulting. Ms. Wiseman began her career in youth development and community building. She discovered her passion for public health through her work in HIV. In all, she has 25 plus years of nonprofit administrative experience and public health program development. Specifically, her areas of expertise include sexual health, youth development, and trauma-informed care. She has worked with many local and national organizations such as the Maryland Department of Health, Community Advocates for Family and Youth, Metro Teen AIDS, Fannie Mae Foundation, Public Allies AmeriCorps, and Hands On Atlanta. Ms. Wiseman is a licensed professional counselor in Maryland. She completed a Master of Arts in Community Counseling at Trinity University in Washington, D.C., and has completed postgraduate coursework focusing on addictive behavior from Capella University. Her undergraduate degree is in communications from Wichita State University. And I might add, she is also a Divine Nine member of the Zeta Phi Beta Sorority Incorporated. And Ann, we would like to welcome you. Thank you so much, Ann. And the floor is yours.
Good morning, everyone. Thank you so much for having me to talk about STIs and STDs. Sexual health and wellness is definitely my passion, and thank you for that beautiful introduction, Arden. I appreciate you. Thank you. So today we're going to talk about sexual health and wellness, specifically STIs and STDs. And let me share my screen with you all. And as Arden mentioned, I hope you can see the screen okay? Good, wonderful.
Yes, we can see it.
As Arden mentioned, I have the beautiful opportunity to work with some beautiful souls at Heart to Hand in Largo, Maryland. We provide also STI testing, treatment, and care. We have free slots for more common STIs, and we also accept insurances. We do STI testing and HIV testing, care, and I'm sorry, my PowerPoint just went a little crazy. Testing, care, and case management. So we are happy to be of service.
And,
so today, yes.
And just to, I know we're going to do this again, but could you tell everyone where Heart to Hand specifically is located? No problem.
Absolutely, absolutely. We are located in Largo, Maryland. So which is in Prince George's County, Maryland, and we're kind of in the center of Prince George's County. So not too far from the District of Columbia, and right near FedEx Field.
Awesome.
All right. Okay. So of course, the presentation just froze up on me. Kevin, I'm not sure if you can here. I'm just going to go through it this way. We're going to go old fashioned and we're going to keep it rolling. So first of all, happy STI Awareness Month. This is really this is a month, just like, it's an awareness month, just like all the rest of the months, but really a chance for us to normalize conversations around sex, sexuality, sexual behavior, and STIs, of course. So today, we're going to talk about sex. You can't talk about STIs without talking about sex. So I hope you all are comfortable with that. I want you to know that this is a safe, judgment-free space. I've been doing this for a very long time, and I'm happy to have any conversations because this is a learning space. So please keep the questions coming. Any comments or concerns, please put them in the chat. We have a short amount of time today, but I'm always going to be available for any questions or anything. So at the end, I'll make sure to give you my contact information. Another agreement is, as people ask questions, just be aware, don't trash my joy, don't yuck my yum. One of those things that I always put out there is I want you to be able to be comfortable enough to ask any question without judgment. So no sub comments about any questions that are being asked. And I believe you may also have the ability to directly ask questions. But if not, again, you'll have my information at the end if you want to email me a question that you don't feel comfortable asking on the Zoom. And I'm going to ask you to listen, respect what's being said, and then listen again. It's important to listen for understanding. One of the tenets of the work that we do in sexual health and sexual health education is understanding that as we give you the information, now you're the sexual health educator, because most of the time I'm not on the phone or hanging out with your friends when these questions or these situations may come up. So it's important that you listen to the information, understand what's being said, and then listen again. I'll give you some links and I'll give you some resources as well. So as I mentioned, today we're going to learn about STIs, some treatment and prevention, but we're also going to talk about what's in between. There's so much to talk about what's in between. In my work with young people, I had a young person that put it to me this way. He said, Miss Ann, you tell us how to put on a condom. You tell us how to take off a condom properly, but you never talk about what's in between. And so that's where I got that from. So it's very, very important to talk about what's in between and the humanness of that. You're also going to learn some tips and tools about starting the conversation. This presentation is not just for you as adults to talk to your kids, but it's also as you as adults to talk to the other adults in your life that may find themselves in a situation where they may need to get tested for an STI or have questions about an STI. There may be opportunities where this comes up, and I want us all to feel comfortable enough talking about it with a straight face and to give the right information and the proper information. I know we're slated for an hour. We may go a little bit shorter. We may go a little bit longer, but I want you to know that I'm here. So, all right. As Arden mentioned at the beginning, STI is a sexually transmitted infection, also known as a venereal disease, sexually transmitted disease, or STD. But basically, an STI is an infection that's passed through the act of sexual activity. So that can be receptive, so vaginal sex, anal sex, oral sex, insertive. So if you are someone with a penis that's inserting, you can also be susceptible to a STI, of course, and skin-to-skin contact. Some STIs, if untreated, can also be transmitted from mother to child. So that's also another distinction to remember. Now, most diseases, the reason we kind of went from STD, sexually transmitted disease, to STI, sexually transmitted infection, is because most diseases are symptomatic. There's a symptom that pops up, and then there's a diagnosis that's made. However, most STIs are not symptomatic. 50% of folks that acquire a STI may not show symptoms. And so it's really important to remember that, because frequent testing, if you're sexually active and if you have one partner or more than one partner, frequent or at least annual testing is important because a lot of STIs are not symptomatic. One more thing about symptoms too And I'll talk about this as we get into some stats. Symptoms may show up between, 1 day up to 90 days, depending on the STI. As I was pulling this presentation together, I started to think about, showing pictures about what STIs look like on different folks. Those of us that have been in the field for a long time know the pictures about the cauliflower looking penis and, the canker sores that are this big on someone. But what I want you to understand is that STIs look different depending on the person. We're all different humans. We all have different experiences when it comes to STIs. The most important thing is to know you're normal. So I always tell folks, get a mirror, get down there, look at your vagina, know your normal discharge, know the normal smells, know what your skin feels like. If you have a penis, lift up your scrotum sac, like know what it all looks like on every part of your body that you have sex. So that's anal, penile, vaginal, your mouth. Like know if you usually don't have bumps and now you have a blister, know that, and you know that you just had oral sex, know that that's abnormal. So know you're normal so that if something does come up, you can ask a nurse, you can go in for treatment, you can go see your physician and see what is this thing? What is this thing that's different? So here's some of the stats. The biggest stat is understanding that STIs are extremely common. A lot of times, and I'll get into this a little bit later in the presentation, but a lot of times we focus on just prevention and just treatment. So prevention meaning don't get it. Treatment meaning, okay, now you got it. This is how you treat it. But understand that STIs are extremely common. And this chart shows you that, 1 in 5 of folks in the US have an STI, either an STI that they're managing or a newly acquired STI. It's very, very common. And some of the most common STIs may be some that you wouldn't think. So HPV is one of those STIs that most of us, by the time we hit 50, have been exposed to human papillomavirus. We've at least been exposed to it. HSV is herpes simplex virus. There's herpes simplex virus 1 and herpes simplex virus 2. For herpes, the stat is probably 1 in 3 folks have herpes, either 1 or 2. Another very, very common virus. And again, once you've reached 50, you've probably at least been exposed to it. And these are both treatable and manageable conditions. And then you see as it goes down, trichomoniasis, chlamydia, gonorrhea. Chlamydia and gonorrhea are very, very common in our young people. Because most STIs come up for us by the time that we're 26. So particularly in the DC, Maryland, and Virginia area, in our, DC, Prince George's County, Montgomery County area, if you are between the ages of 15 and 30 and you are sexually active, you don't use protected sex 100% of the time, you are going to be exposed to chlamydia and or gonorrhea. It is just that common. Particularly if you're between 15 and 30 or 15 and 26. It is treatable, but it is very, very common. In the work that we do, I also have a lot of people that will say, well, is HIV still a thing? And I'm here to tell you it is still a thing. It's a majority of the work that we do, and the majority of the knowledge that I have is around HIV care management. I won't go deep into HIV here, but I do want you to know that particularly in the DC, Maryland area, Baltimore, HIV is still a thing. We're among the areas in the country that are most impacted by HIV. There's 48 different areas in the country that are taking part in the ending the HIV epidemic initiatives. And because Prince George's County, Montgomery County, the District of Columbia, Baltimore City are one of the areas in the country that still have higher than usual HIV rates. We are in that bucket. So HIV is absolutely still a thing. It is preventable. There's a lot of different ways to prevent it, including PrEP, which is pre-exposure prophylaxis. It's a pill that you can take, a daily pill that you can take so that you don't acquire HIV. And then PEP, which is a 28-day regimen of the same medication if you are exposed to HIV. HBV is hepatitis B, and then syphilis is also something that is a very, very common STI. So my point here is that the number of new STIs at any given point is very high. But there's also STIs that once you get them, they are manageable, but they don't go away. So in that list, in the treatable but repeatable list is syphilis, chlamydia, gonorrhea, trichomoniasis, pubic lice, and hepatitis C. Now, please understand that this list is not a complete list of every STI that's out there. There's so many different versions of STIs, but these are the most common STIs. And these are all treatable, meaning that they are able to be cleared with medication or with treatment, but they are repeatable. You can get reinfected. So getting the treatment is not the magic shield. You can get reinfected with STIs. The hepatitis C cure is one that's happened in the past, I want to say maybe 15 years or so, that there's been a cure available, might have been a little bit longer, but there's been a cure available for hepatitis C where it can clear the virus from your body. And that is a really big deal because that science is leading to a lot of treatments that are becoming available for HIV. And also pushing us towards finding a cure for HIV. So again, ending that epidemic.
Hey, Ann,
Yes.
just to interject real quick, the question did come up. Can you expand a little bit more about the human papillomavirus? We know that there is a vaccine out about that. Can you expand on HPV vaccine and a little bit more, please?
Absolutely.
Thank you.
So let me jump over here to this column with the not curable but manageable. So there is a vaccine available for HPV. Yes, it's called Gardasil. And it is available for young people as young as 12 that can get that can get the vaccine, and it will protect you from the most common strains of HPV. There's a lot of strains of HPV as well, but the vaccine will protect you from the most common strains of HPV. And because HPV, if left untreated, again, remember that with most STIs, including HPV, a lot of times symptoms don't show up or symptoms may be mistaken as something else. But if left untreated, HPV can lead to cancers. So cervical cancer, anal cancer, it can lead to different cancers. That's what you want to definitely protect yourself from. And so that's why getting the vaccine is really important. And it's important to have those conversations with your young people. I believe they just expanded the age where you can get the vaccine. And I'm going to get this information for you because I don't know it off the top of my head. I apologize, but I know they just expanded the age to, I want to say it's over 30, where you can still get the vaccine. And I think I saw another question come up in the chat.
Yeah, it did. And the question was, there are reports of some resistant forms of gonorrhea and other typically treatable STIs. Have we seen any of those resistant forms in the DMV?
Absolutely. Oh, I just love y'all. Thank you with those questions. So there have been definitely treatment resistant strains of gonorrhea that have come up. And that's what's important to remember about STIs. There is nothing new under the sun. And so STIs have been around for a long time. And, our treatments have changed over the, many, many years that we've been trying to treat STIs. So it's just gonorrhea's turn. So there have been treatment-resistant strains of gonorrhea. There have been some treatment-resistant strains that have come up, but in general, in the DMV area, the treatment, and I can't say it, but the treatment is still available. And for the most part, the common treatment that we have is working. But it is very, very important to remember that those treatment-resistant strains are out there, and it's just a matter of time. And so it's very important to get tested and talk to your provider, and have a good understanding of what the treatment modalities are that are available. What other questions do you have? You all are driving this presentation. I appreciate the comments and the questions.
Yeah, right now, and there are no more
Okay.
questions in the chat, but I'm sure some more will come up as you continue.
Excellent, excellent. So a couple of other things I wanted to hit on this slide before we go. There are 4 reportable, mandatory reportable STIs by law. And those are syphilis, chlamydia, gonorrhea, and HIV. And the reason that those are reportable is, one, they're fairly common STIs, but more importantly, if left untreated, those 4 STIs can either lead to fertility issues, or can lead to death if left untreated. So, for example, we know HIV, if left untreated, it impacts your immune system, it impacts your body's ability to fight off different infections, and it can lead to death. Syphilis can lead to neurosyphilis if left untreated. And so it can impact your brain. It can also, we're seeing rising rates of congenital syphilis. So in other words, syphilis that's being passed on from mother to child. And syphilis particularly can have a severe impact on a newborn. It can cause birth defects. And it's something that we had really, I don't want to say eradicated because clearly it's back, but we had really gotten the rates down in terms of congenital syphilis by doing contact tracing and by making sure that if somebody has acquired syphilis, that we do tracing similar to COVID. So we're going to ask, have you been with somebody that needs to be tested? The health department does that in a very confidential way, or it's intended to be a very confidential notification system where they'll notify the person, have them come in. And the point is not to point fingers, but it's to get treated and to get the treatment out before it gets to be an epidemic, kind of on epidemic levels. But we have seen a rise in syphilis. And actually, there's been a rise in all STIs in the past couple of years. COVID was not necessarily kind. And so testing was down during COVID because we weren't going out to our physicians as much, and we were doing much more telehealth. So testing was down. So STI rates have gone up, as we've seen in these past couple of years that we've been going out more. The other thing I wanted to mention on the side of not curable but manageable is that that with hepatitis B, that is, most adults can clear hepatitis B without treatment, but there is also a vaccine available for hepatitis B. So I wanted to throw that out. We were talking about vaccines for human papillomavirus for HPV, but there is also a vaccine available for HBV.
And thank you. And
Yes.
there is another question.
Sure.
I don't know if you're going to get to this. And if you do hear a question that you're going to cover, just you could table it. But a great question just came through.
Absolutely.
The person asks, being protected while having sex doesn't prevent contraction of STIs. Is that correct? So what is a better way for higher protection against STIs? And again, if you're going to get to this, fine. If not, if you want to answer it now, but I just want to make sure when the questions pop up, I'll let you know. And that came from the Facebook Live. side.
Absolutely. No, perfect, because that's my next slide.
Oh, awesome.
So no, this is perfect. I love it. Keep the questions coming. So I'm going to talk about reducing the risk. So you're right. Being protected isn't 100%. So the 100% way to protect yourself is abstinence. And we are all human beings, and sexuality and sex is a part of our human experience. So abstinence isn't always an option for everybody. So these things on here are not necessarily in any particular order, but there's abstinence, there's self-pleasure. The main thing for protecting yourself is communication. Be comfortable enough to have the conversation with your partner or partners. And, have you been tested for an STI? The yes or no answer is not where you stop. What STIs have you been tested for? What was the result? Are there any particular precautions that we need to take? Is there medication that you're on? Is there medication that I need to be on? And in that, I'm speaking in terms of proper PEP. If you're going into a long-term relationship with somebody who is living with HIV. But communication is the main thing. Communication before, during, and after. And if this communication happens in the framework of an hour, or days or weeks or months, like the communication needs to happen. And I say that because communication on both sides. So if somebody does disclose to you later that they tested positive for an STI, it's just understanding your risk going into that's kind of part of the experience, honestly. And so going to get tested yourself, and to go and going to get treated, and understanding, what your risks are going into it, understanding what treatments are available, and where everything is with the STIs. On treatment, and I know there's one more question, but let me tell you this before I forget. In terms of treatment, and if somebody tells you that they've tested positive, understand that if you wake up the next morning and you're like, something just doesn't feel right, and you go get tested, if it's that soon, sometimes the STI may not come up because it will have just happened. STIs take from any time between 1 day to like 90 days to show up, either symptomatically or even within test results. So you can get tested if you're not symptomatic, you can get tested, within a week, probably. So for some STIs, and they'll come up, so chlamydia, gonorrhea may come up within, 5 to 10 days. It may come up on a test result. HIV can take from 1 week to 3 months to come up in a test result. So that's why I say that getting tested often, now you don't have to get tested every week, but, between using condoms, either latex condom or polyurethane barrier, so non-latex condoms, because a latex allergy is a thing, between using barriers with condoms, using other harm reduction things like more lube so that there's less tearing, and communication, though using all those things and getting tested regularly, then you should have a good plan for, being able to prevent STIs, or at least prevent STIs from going untreated. Some of the other things, mutual monogamy with a partner with a known or managed STI status. If somebody discloses to you that they have a STI and they're managing it. So for example, I'm gonna use herpes as an example because that's, again, one of the more common STIs, but it's manageable. If somebody discloses that to you, understand, just ask more questions, understand how they're managing it so that you can understand your risk and move on, or choose not to move on. And then the other thing I want to mention, and this is really, I'm thinking about young people in our area. It's important to have sober sex, meaning understanding that your inhibitions go down, your ability to communicate goes down, your ability to make informed decisions go down, the more inebriated you may be. So the higher you are, or the more alcohol that you drink, your ability to make decisions go down. So it's just something to be aware of. I'm not trying to yuck your yum. I'm not trying to take your fun away, but just something to be aware of is make a decision while you're sober about this person or what you're going to do, so that you can have an informed decision. And Arden, I see there may be another question.
Yeah, and there was a good one just regarding condoms. Are all condoms created equal, or are there certain brands or materials better than others?
Oh, I love it. Great questions. All condoms are not created equal. And all condoms, when you're thinking about condoms, think about you and think about your partner. So I think one of my first rules with condoms is everybody does not need a Magnum. Let me repeat. Everybody does not need a Magnum. I know that seems to be kind of the gold star, especially when I was working with young people. They always ask for Magnums, and the thing with condoms is, and I'm looking for kind of a prop. So a condom can fit over this easily. It can fit over a soda bottle easily, right? So when I say everybody doesn't need a Magnum, understand that there's condoms out there for every size, and every fit. There's also condoms out there that allow a lot of fun. So there's latex condoms, and then there's non-latex condoms, which are polyurethane condoms. Some folks have latex allergies, and those latex allergies can look like, so if you're if you're an insertive partner and you have a latex allergy, what shows up can be pain, irritation, burning, itching, which is very much a common STI symptom, right? And so understanding that if you switch your condom, then you may not have those things. You may not have those reactions coming up. But there's ribbed condoms, there's glow-in-the-dark condoms, there's flavored condoms for oral sex. There's a lot of different barriers. There's also dental dams, which is like a square of latex or polyurethane that you can use to put over a vagina or over an anus if you're going to give oral sex. And so you'll get the sensation, but you won't have the transmission of bodily fluids if that's something that you're trying to prevent. So there are a lot of different things that you can do with condoms. You can have fun with it, and still protect yourself. Remember, though, that condoms are only going to protect what they're covering. So there are things that are skin-to-skin contact, that you still need to be aware of. One of the other things that actually I didn't even put on here, but I wanted to mention is keep the lights on for a minute, just a little longer, and look at your partner. And I say that in a loving and in a fun way. You don't have to go in with the magnifying glass and do an inspection, but look at your partner as a person first, and look at them. Our genitalia is a part of our personhood. And so keep the lights on and look at your partner, and understand the nuances and the differences that are happening. So I hope that answered the question. Were there any other questions?
And there was, okay. You
No
may
worries.
get into this later, but I think they're great. Can you talk, Ann, about the risks or consequences of moving from anal to vaginal sex?
Yes. There are a lot of risk in moving from anal to vaginal sex. So one, the vagina is very, it's delicate and it's fragile, and you should take very, very good care of it. If you are owner of a vagina, or if you are taking care of vagina, treat it with care. Same thing with penis. Treat it with care as well, and with all your sexual organs. Now, just understand that with anal sex can be messy. And there are bacteria that are in the rectum that you don't want introduced into the vagina. So be very careful about moving from anal sex to vaginal sex. If you can go from vaginal to anal, But if you're going from anal to vaginal, and this isn't to yuck your yum, but I'm telling you, pull out, wipe off, just get a new condom. Make sure that you do a clean transition from anal sex to vaginal sex so that your partner then doesn't come up with, a yeast infection or anything worse from moving from anal to vaginal sex.
Awesome. And there some good ones are coming.
Good. Go.
And what you may have touched this, but what is the percentage chance of contractions even with a condom on?
You know what? It varies. It depends on the user of the condom. And how much care that you've given that condom. So for example, if that condom's been in your wallet for the past 3 years or in your glove box for the past 3 years, then it may not be the best condom to use because it may break down. If you're using the wrong lube, if you're using, a lube from the kitchen that's an oil-based lube, then that has a tendency to break down a condom. So if you're not using a silicone or water-based lube, then that may cause the condom to break. So it depends on the user. The percentage may change. If a condom is used properly, then your chances can go down. But again, remember, it's skin-to-skin contact. The other thing is we tend to put a condom on when we get into either vaginal or anal sex, but we don't think about oral sex because you can get chlamydia and gonorrhea in your throat. You can, and so it's important to remember that, again, when you're thinking about the risk and just thinking about how common things are, and you're thinking about symptomology, remember that you can get chlamydia and gonorrhea in your throat. And so when you go get tested, you should get tested. We call it a 3-point test. So if you have oral sex, vaginal sex, and anal sex, oral sex, inserted vaginal sex, so you have a penis and you have vaginal sex with your partner, you should get tested in all 3 areas. It's a swab. It's easy, it's painless, but you can have chlamydia and gonorrhea in your throat, and maybe you never had insertive sex, but it can happen. So that's really important to remember. And I know the question was about condoms, and I hope I answered that and about the percentage, but all the other things come up.
No, and that was great. So a couple more real quick.
Sure.
And again, if you're going to see these on your upcoming slides, please know. I know you have a few more slides, but has there been any movement towards making STI testing mandatory, or have testing suggested to be as frequently as like the flu and COVID shot? I know you had touched on a little bit about things earlier about the frequency of testing, but did you want to elaborate? I want to make sure the person's question gets answered.
No, absolutely. So STI testing is a part of your preventative care. So at the very minimum, when you go in and you get your annual exam every year, which is your annual preventative exam, which is covered through the ACA, so Obamacare, that whole act was about preventative care. And so you might have to be your own advocate though, because a lot of times doctors won't offer that just off the break. They'll get all your blood pressure, and we're going to see what your blood sugar is and all that. But a lot of times it doesn't come up in the conversation. You, as the patient, can bring that up. So at least annually, you should ask for an STI screen. When you ask for an STI screen, make sure that you talk about the types of sex that you are having. So the example I just used, they can do a STI screen. It'll be some of the more common STIs. But if you are having oral sex, then say that you want to swab. If you are having anal sex, say that you want to swab. So those can be included in there. For women, if you're going for your annual Pap exam, understand that your Pap exam is not a STI test that's happening at the same time. They are looking for abnormal cells in your cervix. That's kind of it. And so you need to ask for, and if there's anything that comes up that's symptomatic at the time, then they may test and treat for that. but you need to ask for a STI screen at least annually. It'll be covered. If you are more sexually active, then you can do it, kind of as often as you need be. So, for example, for HIV, we tell folks who are sexually active for HIV, get a test every 3 months. You can get tested for HIV free. It's a finger prick. You can come to Heart to Hand and get tested for free. And if you get tested every 3 months, then that'll give you a good baseline of where you're at. I am with Kaiser, and this is by no way a commercial for Kaiser, but I've noticed that on their online platform, you no longer have to have a referral from your physician to be tested for STIs. It's just part of the labs that you can order for yourself. So like, how you can used to be able to go on and order your COVID lab, you can order STI labs. I'm not sure how, I just kind of noticed it not too long ago. So I'm not sure how often you can do that, but you should do it as often as you feel like you need to do it. At least once a year, as much as every 3 months, depending on how sexually active you are.
And awesome. Here's another good one. Should certain groups of individuals be tested more frequently than others? For example, college students, sex workers, etc. And I guess to piggyback on that, since it's about testing, and how would you feel about mandatory college campus testing? They've mandated, why have they mandated COVID testing every month, but nothing for STDs or STIs? So they're two different questions, same person, but it's two different questions. So,
and very good questions. Repeat the first question again.
So the first one was, should certain groups of individuals be tested more frequently than others? For example, college students, sex workers, etc.
So for that first question, know thyself. So if you are more sexually, I'm not going to put anybody into category. So that's my answer. Because there's some college students that may not need to get tested all the time. But you need to know yourself. And so if you are very sexually active, if you have multiple partners that you don't know, that you are not in communication with, and you don't know their background, and you don't know their STI history. If you are a sex worker, then yes, you should get tested more often, and know yourself. And you should have a provider that you are a buddy with, so that you can go in and get tested as often as you need to be tested. Because again, from a public health perspective, we want to make sure that folks are comfortable enough to getting tested. I think we're going to test you as much as we need to test you, because we don't want things to get into more of an epidemic. Understand that 1 in 5 people having an STI is an epidemic. So let's understand that first. But the different STIs, as I mentioned before, have different outcomes if left untreated. So we want to make sure that everybody that acquires a STI or is exposed to a STI gets the treatment that's needed, or the infection management that's needed, so that it doesn't kind of explode and we have even more people impacted by STIs. The second question was about mandatory testing. Arden?
Sorry, Ann, I was on mute. The question was, how do you feel about mandatory college campus testing, and why have they mandated COVID testing every month, but nothing for STD or STIs?
So I'm going to go further upstream on that. As opposed to mandatory testing, I think that we start more with mandatory sexual health education. So making sure that we start with young people in middle school, in elementary school, just talking about what's happening to your body and understanding what's going to happen to your body as you go into puberty. In middle school, managing feelings. We all remember what that was like, and it's so important to normalize the conversation, so that when you become in high school and get to college, you can more advocate for yourself and understand your normal. And you've already had these conversations. And so you understand when you need to get tested and how often you need to get tested. And it doesn't become so locked in shame. I know there may be some questions on that, but I just really wanted to get to that part because stigma is when we talk about like what causes STIs and what causes the explosion, and it's stigma. Stigma leads to the shame, the judgment, the finger pointing, the blame, instead of normalizing the conversations. We don't tend to I don't know, what's the word I'm looking for? Yell at people who have the flu, right? You get the flu. Okay, so you got the flu happens. Same thing with STIs. Sex happens, STIs happen. We've got to normalize the conversation and understand that between prevention and treatment, like don't get it, because that's in that concept of prevention can come from a shame perspective, and then treatment. Okay, so take this pill, and manage this, but only talk about it with me, the provider, or with me, your partner. That can also be anchored in shame. But understanding that sex is meant to be pleasurable, it feels good. That's why a lot of us have it. And so understand that with sex comes responsibility. So for my young people, I used to say, just because you get your driver's license, does that mean I'm gonna let you drive my $80,000 car? No, I don't have an $80,000 car. I'm just saying. No, it doesn't mean that. It means that you start with the basics, you learn your responsibility, you understand the consequences. And so if you get in an accident, you understand accidents happen. This is what the insurance looks like. So this is what, it means to go get health care. There's a lot of responsibility that comes with that pleasure, but it is definitely a part of the human experience. And so in between all that is understanding addiction, drama, curiosity, just being in the moment. There's something to be said for skin to skin contact and skin to skin intimacy. It is important, y'all. And so I don't want to come at this presentation. That's one of the reasons I didn't include all the ugly penis and vagina pictures, is because sex is meant to be pleasurable. It's meant to be fun. And so that's an important distinction to remember. And that's why we got to remove the stigma and let's just have these conversations about how to protect yourself, about what can come up with sex, and about the different things that you like about sex. What do you like? What do I like? Because if you can talk about sex, then you can talk about anything. So I just wanted to point that out. And I know that my time is running out. Arden, were there any other questions? I probably have like two more.
And there are. Let me let you go get through your slides, and then we'll have
Okay.
a few more questions for sure.
Very good. Very good. So just quick points. We've said all this now. Everybody on here now, you are the sexual health educators. I am sending you forth with this information in hopes that you can now have judgment-free conversations, stigma-free, or at least start working on stigma-free conversations with your partners, with your friends, with your boys, with your girls, with your children, with your cousins, nieces, and nephews, like all that. Be that safe space for somebody. And ways to do that is making sure that you do drop judgments. Try to have conversations with a straight face. It takes practice. I've been in this for over 20 years. And every once in a while, I'll get a question where I even drop my jaw. It's okay. But also seek first to understand what the question is or what the concern is. And then you can offer your information and offer the solution. Ask questions if you don't understand. We often say, "Oh, kids these days are doing these things." Come on, y'all. We grew up in the 80s. We weren't perfect. In the 80s and the 90s, we weren't perfect. So there's nothing new under the sun. But ask questions if it's being presented in a way that you don't understand. And create a safe space. You can get the conversation going by using teachable moments. I know with my daughter, who's a teenager, oftentimes we'll be watching TV, we'll point something out, and then we're able to have a conversation. Or she's telling me about something at school, and we're able to have a conversation. So just remember, like, communication, try to drop the judgments, understand, also check yourself. Like, we all have our different values and our different morals, our different moral compasses. And so check yourself and understand that if you're coming from your perspective, it may not be that other person's perspective. It doesn't mean that you're wrong. It just means own that, well, this is my opinion. You may have a different opinion. So let's talk about it and let's see if we can come to a conclusion that works for that person if they're seeking your help. So, check yourself and understand what you can, what you're comfortable speaking about. And if you're not comfortable about speaking about something, then please refer that person to somebody else who may be. And again, without judgment. And this last slide is really just a quote. Thank you, Sue. She says, sex is perfectly normal. It's something that is pleasurable. It is enjoyable and it enhances the relationship. And so that's why we talk about it. We need to be comfortable. Sex and sexuality is a human experience. We are all sexual, and so we really need to be comfortable in having those conversations. All right, I know we're getting to the end. What questions you got?
Yes, sir. And there were a couple of more questions. I really appreciate the Facebook folks for asking. This question came up: would female condoms be better to use than male condoms?
Thank you. I forgot to bring up the female condom or the insertive condom. And I wish I had one with me. I'm out of town, so I'm not, I don't have all my props with me. But a female condom is an insertive condom. So I'm going to kind of use this as an example. So you can insert the condom into the vagina, and it has a ring that kind of anchors itself at the bottom of the cervix. And then the other part of the condom comes out and covers this part of the vulva. And it is an empowering way for people with vaginas to be able to protect themselves because, one, it's polyurethane, and two, because it's polyurethane, it will conduct heat a lot better. So it feels less like there's something, like there's a barrier there, but you can insert it up to, hours before you are having sex. And so it's something where you don't have to stop and then do something different. Better, again, is the other thing with the insertive condom is it can be used anally. So remember, it has a ring that anchors at the bottom of the cervix, but you can take the ring out. You can use the ring to insert anally and take the ring out, and same difference. So it's still going to cover a part of the rectum on the outside, which will help with some of the skin-to-skin contact. Now, better, again, depends on the user. And so, experiment and see if that's better for you, or if a traditional condom may be better. Do not use them both, though. If you're using an insertive condom, do not use a condom for the insertive partner, because then that can lead to them tearing. So use one or the other.
Awesome. And here's another great question. I think it's a great way to end it. This is from the Facebook folks. There was a mono outbreak at my campus when this person first attended, due to the cafeteria being negligent, and they couldn't trace it. So many students got sick. How could a campus prevent an outbreak of that magnitude? Ooh, that's a good one there.
Ooh, that is a good one. That's public health in a nutshell. So so things like that may happen. It can happen with, mono or hepatitis is another. Hepatitis A is one thing, definitely with campuses, with food, that, you can have an outbreak of things like that. You can also have an outbreak of HIV. The important thing is to work with the health authority on that campus. So they may be working with the health department, who may come in for treatment, testing, screening. So again, that's why it's important to normalize these things. We all know our lessons from COVID. So if you've been, exposed, go get screened, keep an eye on your symptomology. And if something comes up, get treated. So same thing with things like that. We are in you know, in a world where if you go outside, you're going to get exposed to something. If you go to the mall, if you go to a club, somebody's going to cough, somebody's going to sneeze, you're going to get exposed to something. Know you're normal, keep an eye on your symptomology. But if you are notified that you've been exposed to something and there's been an outbreak, then don't panic. Get screened, follow the health authorities, and understand what needs to happen. The screening, the testing, the treatment, keep an eye on symptomology, and working with your physician or with the campus health center.
Wow. And there were no other questions in the chat or on the Facebook Live. And I just want to thank you for a killer presentation. And from a personal note, as I said at the beginning, I've known Ann for a number of years. I know Ann is the deputy director. I know the director, Deidre Spears Johnson.
Much love.
But these are great friends of mine as well. I can say that, and I can say that Heart to Hand does great work in Prince George's County. So for those of you who are listening on Facebook Live, if you're listening anywhere else in the country, they are absolutely wonderful. They care. It is a judgment zone space. I've had many conversations. I have 3 boys. I've thrown out questions. They're an excellent resource for Prince George's County. I would encourage folks to, if you don't know about Heart to Hand, get to know Heart to Hand, especially for your entire family, regardless of their age. If you're 55 like me, or if you're, a young person, please utilize their services if need be. But Ann, once again, on behalf of the brothers of the Gamma Pi chapter of Omega Psi Phi fraternity, we want to thank you once again for this awesome presentation. We want to thank those of you who tuned in and listened on Facebook Live. We thank you. Tune in again next month. We have these every single month. And we, even if you miss one, you can go back to the Gamma Pi's site and we have them recorded. There have been some great health initiative discussions. So I would encourage you, if this is your first time, or if you've attended these numerous times, please go back, check out the other health initiatives talks. They've been absolutely wonderful. And I don't think there's anything else.
Thank y'all. Thank you.
And that's it. And you're the best. I'm sure I will see you and your colleagues soon. So thank you again for everyone for tuning in. We really appreciate it. And we wish everyone a great weekend.
All right. Take care, y'all.
All right. Thanks, Ann.